Hey everyone, and welcome back for another deep dive.
Yeah,
Today, we're going to be looking at something called spinal arachnoid diverticula in cats,
absolutely.
SE for short.
Yeah.
We're diving into a study from the Journal of Veterinary Internal Medicine from 2025, and this condition is considered to be pretty rare,
Yes, it is.
and it's maybe a little bit under-researched in cats.
Absolutely.
So, what is SA? Can you break it down for us a little bit?
So SAD is a focal dilation of the subarachnoid space,
Okay.
which then compresses the spinal cord.
So it's like a little pouch of fluid pushing on the spinal cord.
Yeah, you can think of it like that.
Okay.
So like a little balloon almost.
Okay, interesting.
Yeah.
And so this study looked at 21 cats across multiple veterinary
Oh,
hospitals,
right.
and it found that most of the cats with SAD were domestic short-hairs male,
Mm-hmm.
and they had a wide age range.
Exactly.
Now, one of the things that really struck me about this study was that nearly half the cats didn't have any other identifiable spinal problems
Yeah.
alongside the SAD, which kind of suggests that SAD in cats might not always be a secondary condition.
Yeah, that's a big takeaway from this particular study because before we thought it was always secondary to something else like IVDD
Right.
or trauma or something like that.
Or a tumor, something like that.
Right, exactly.
So this really kind of like throws a wrench in things in a way.
Yeah, it's a whole new way of thinking about it.
Yeah.
And it kind of makes us wonder, what could be causing this
Right.
if it's not secondary to something else?
Yeah, that's a big question.
What's causing these primary cases?
Yeah, what is the root of this?
Exactly.
That's the burning question.
Yeah, it is.
So let's talk about what this actually looks like in a cat.
Sure.
So what kind of symptoms
Mm.
might owners be on the lookout for?
Most commonly, we're going to see a chronic, progressive, non-painful myelopathy,
Okay.
meaning that it's going to progress slowly over time. It's not going to be painful.
Right.
But we're going to see signs that the spinal cord is not working properly.
So like what?
So we can see things like ambulatory paraparesis, pelvic limb ataxia.
Okay, so weakness and incoordination
Yeah.
in
Yeah.
the hind end.
Yes.
Were there any unusual presentations in the study? Anything that stood out as particularly unique?
There was one case that was particularly interesting.
Right.
That presented with vestibular signs due to a SAD at C1.
Oh, wow.
So it was actually affecting the cervicospinalovestibular tract.
So a SAD in the neck can actually cause dizziness and balance problems.
Yeah, exactly.
Oh, that's interesting. I never would have connected those two.
Yeah.
So how do vets even go about diagnosing something as specific as SAD?
The gold standard is an MRI.
Really?
Yeah.
So they're looking for something specific on the MRI, I'm assuming?
Yeah, so they're going to see that focal dilation
Okay.
of the subarachnoid space.
Uh-huh.
And it often has this really characteristic teardrop or scalpel blade shape.
Right.
And they're also looking for signs of spinal cord compression
Makes sense.
because that's going to be what's causing the clinical signs.
Now, did the study mention any other findings on the MRIs? Anything that might add to the diagnostic puzzle?
Yeah, they also found syringomyelia
Oh, wow.
in over half the cats.
So these cats are facing a double whammy, the SAD,
Yeah.
and then these fluid-filled cavities.
Mhm.
Is there a connection there?
We don't really know if it's a direct result of the SAD or if it's a separate issue altogether.
That's the crux of the matter, isn't it?
Yeah.
Is there a connection there, or are they completely separate?
We need more research to
Yeah.
really figure that out.
So let's talk about treatment then.
Okay.
What did the study reveal about how SAD is currently managed?
So there are two main approaches,
Okay.
medical management and surgical intervention.
Okay. Can you break those down for us a little bit? What does each approach involve?
So medical management is going to involve things like controlled exercise, physical therapy, and medications.
Okay.
The goal is to manage the symptoms and improve the cat's quality of life.
So it's about making the cat as comfortable as possible and slowing down the progression,
Exactly.
even if we can't completely cure it.
Right.
What about surgical intervention?
Surgical intervention is going to involve a laminectomy or hemilaminectomy,
Okay.
and usually a durotomy.
So they're basically going in and trying to relieve the pressure.
Yeah, exactly. They're trying to give the spinal cord more space.
Okay. Did the study find that one approach was more successful than the other?
In the short term, they found that about 75% of the surgically treated cats showed improvement.
So the surgical approach seemed to have a more immediate positive impact.
It did, but they also found that about 25% of the cats treated medically also improved.
Okay, so even without surgery, some cats did experience benefits.
Yeah.
But I'm guessing based on your tone, that the long-term outcomes weren't as promising.
Unfortunately, that's true. When they looked at the long-term outcomes, it wasn't as rosy.
So even with these interventions, the prognosis for cats with SAD isn't very optimistic.
It's a challenging condition to treat, and the long-term prognosis can be guarded.
Did the study offer any insights into why the treatments weren't more successful in the long run?
2 cats in the study had repeat MRIs, and both showed recurrence of the SAD at the same site.
So even if the initial treatment seemed successful,
Yeah,
there's the chance the SAD could come back
that's a possibility.
and the symptoms could return.
Yes.
I'm curious about those primary cases of SAD again.
Sure.
Do we know anything about how those are treated compared to SAD cases that are secondary to other spinal problems?
They didn't really compare the treatment outcomes between primary and secondary SAD.
Okay.
It's an area that needs more research.
It makes sense that we'd want to tailor treatment strategies
Yeah.
based on the underlying cause.
Exactly.
Well, this has been a fascinating, albeit slightly sobering, dive into the complexities of SAD in cats.
It is a challenging condition.
What are some key takeaways you think our listeners should remember?
I think the main thing is that even though it's rare, it should be considered in cats with those clinical signs that we talked about.
Especially if those symptoms are chronic and progressive.
Yes.
But the cat doesn't seem to be in pain.
Exactly.
And early diagnosis and appropriate treatment, whether medical or surgical, can make a big difference.
It can.
This deep dive has really highlighted how much we still don't know
Yeah.
about SAD in cats.
There are a lot of unanswered questions.
But it's also sparked a lot of curiosity.
Mm-hmm.
What are some of the big unanswered questions that you think researchers should focus on in the future?
Well, I think the biggest question is what's causing those primary cases?
Yeah, that is the big question.
We need to figure that out.
If it's not trauma or other spinal issues, what is it?
Exactly.
Could it be diet environmental factors, breeding practices? There's a whole mystery to unravel here.
Right.
And then, of course, we need more research into more effective treatment strategies,
Absolutely.
both medical and surgical.
Yeah.
Can we prevent recurrence after surgery?
Right.
Can we develop medications that target the underlying causes? So many questions. So much more to learn. This study has really opened a whole new chapter in our understanding of SAD.
It has.
We've talked a lot about the clinical aspects of this condition, but I'm also curious about the emotional impact.
Yeah.
What's it like for owners to navigate a diagnosis of SAD in their cat?
It can be really hard.
Yeah.
You know, they see their cat struggling.
Yeah.
And they feel helpless.
Yeah, I bet.
It's tough.
What advice do you usually give to owners who are facing this diagnosis?
I always emphasize open communication with their vet.
Okay.
Asking questions, expressing concerns, and seeking a second opinion if they need to, and then just focusing on providing the best quality of life for their cat.
That might mean adjusting their environment
Yeah.
to make it easier for them to get around.
Exactly.
And there are also online support groups and resources available.
There are.
It's a reminder that they're not alone in this journey.
Absolutely.
Well, I think we've done a pretty thorough job of unpacking this particular study and exploring the broader implications of SAD in cats.
Yeah.
Before we wrap up, are there any final thoughts you'd like to share with our listeners?
You know, just to reiterate that even though it's a tough diagnosis,
Yeah.
there's hope.
Right.
With more research, we can learn more and develop better treatments.
And that's a message I'm sure our listeners will appreciate.
I hope so.
And to all our feline enthusiasts out there, if you're concerned about your cat's neurological health,
Yeah.
don't hesitate to reach out to your veterinarian.
Absolutely.
They're your best resource for information and guidance.
They are.
And until next time, keep those minds-inspired hearts light and tails wagging.
Absolutely. And the goal with medical management is to try to improve that cat's quality of life as much as possible.
Okay, and what does that involve? Like, what kind of medications are we talking about?
So it depends on the individual cat,
Right.
but it could involve things like pain medication if there is any pain.
Okay.
It can involve muscle relaxants if there's a lot of spasticity. And it can also involve medications that help with nerve function.
So kind of like a cocktail approach.
Yeah, exactly. You kind of have to tailor it to the individual.
Okay, and what about the physical therapy aspect? What does that look like?
So physical therapy can involve a lot of different things.
Okay.
It can involve things like range of motion exercises.
Okay.
It can involve strengthening exercises.
Okay.
And it can also involve things like underwater treadmill therapy.
Oh, wow, that's interesting. I didn't realize that was something that was done for cats.
Yeah, it's becoming more and more common.
And what about assistive devices? Are those ever used?
Yeah, sometimes we'll use things like harnesses
Okay.
or slings to help the cat get around.
So really, it's about maximizing their mobility and their comfort.
Exactly.
Okay, what about surgical intervention then?
So surgical intervention is going to be reserved for cases that are not responding to medical management
Okay.
or for cases that are very severe.
And remind us again, what are those procedures that they might do?
So they might do a laminectomy or a hemilaminectomy.
And what exactly is a laminectomy?
So it's basically where they remove part of the bone that's covering the spinal cord to give it more space.
To relieve that pressure.
Yeah.
Okay, and what about a durotomy?
A durotomy is where they actually make an incision in the dura mater.
Which is the membrane surrounding the spinal cord.
Yes.
Okay, so again, it's about relieving pressure.
It's all about creating space.
Okay, so did the study find that one approach was more successful than the other?
Yeah, they did.
Okay.
They found that in the short term, the surgically treated cats tended to do better.
Okay.
But in the long term, both groups had similar outcomes.
So regardless of whether they had surgery or just medical management, they tended to have similar outcomes.
Exactly.
And what were those long-term outcomes?
So unfortunately, the long-term prognosis for cats with SAD is guarded.
Meaning?
Meaning that most of them do end up deteriorating over time.
Even with treatment?
Yeah, even with treatment.
Why is that? Why do you think the treatments are more successful in the long run?
I think there are a few reasons.
Okay.
One reason is that the SAD can actually recur.
So even if they have surgery to remove it, it can come back?
It can come back in the same spot.
Wow.
Another reason is that there can be permanent damage to the spinal cord.
From the compression?
From the compression.
So even if you relieve the pressure, there might already be some damage that's been done.
Exactly.
That can't be reversed.
Unfortunately not.
And you mentioned earlier that syringomyelia is often seen in these cats as well.
Yes.
Do we know if that plays a role in the long-term prognosis?
That's a good question, and we don't really know for sure.
Okay.
But it's possible that the syringomyelia could also contribute to the deterioration.
So it's kind of like a multifactorial problem.
Yeah, it's complex.
There's a lot going on.
It's not just one thing.
And I'm curious, again, about those primary cases of SAD where there's no identifiable underlying cause.
Yeah.
Do we have any idea how to prevent those?
Unfortunately not, because we don't know what causes them.
Right.
It's really hard to prevent something when you don't know what causes it.
That's the burning question, isn't it?
It is.
What is causing those primary cases?
Yeah. We need to figure that out.
All right, so we've talked about diagnosis, we've talked about treatment, we've talked about prognosis. What are some key takeaways you think our listeners should remember about SAD in cats?
Well, I think one of the most important things is that it's a serious condition.
Okay.
But it's not always a death sentence.
Okay.
With early diagnosis and treatment, we can often manage the symptoms and help the cat live a good quality of life.
And if owners notice any signs of neurological problems in their cat, they should take it seriously.
Absolutely.
And get to the vet as soon as possible.
The sooner the better.
Okay, good advice.
Yeah.
Well, this has been a fascinating look at SAD in cats.
It has.
But the world of feline neurology is vast.
It is.
And there are so many other conditions that can affect our feline friends.
So many.
What are some other interesting cases you've come across in your work?
There are so many.
Let's pick one.
Okay, well, one that I always find really interesting is feline hyperesthesia syndrome.
Okay, what is that?
Have you ever heard of that?
I have, but I don't really know much about it.
So it's also known as rippling skin disease.
Rippling skin disease. That sounds a little creepy.
Yeah, it can be a little strange to see.
What are the signs?
So cats with this condition will often have episodes where their skin ripples or twitches.
Really?
And they may also groom excessively.
Like overgroom to the point where they're losing hair.
They can even create sores.
Oh, wow.
And they may also vocalize and seem really agitated.
So it sounds like it's not just a skin problem.
It's not. It's actually a neurological problem.
Okay.
We think it's caused by abnormal electrical activity in the brain.
So it's almost like a seizure?
Kind of, but it's not a full-blown seizure.
Okay.
It's more like a localized seizure.
So what causes this abnormal electrical activity?
We don't know for sure.
Okay.
There are a few theories.
Like what?
Some people think it might be genetic.
Oh, yeah?
Some people think it might be related to stress
Okay.
or anxiety.
So again, we're back to the nature versus nurture debate.
Yeah, exactly.
So how is it treated?
So there's no cure for feline hyperesthesia syndrome.
Okay.
But there are things we can do to manage it.
Okay.
Medications can be helpful.
Okay, what kind of medications?
Things like anticonvulsants
Okay.
or antidepressants.
So basically medications that help to calm down the nervous system.
Yeah, exactly.
What about environmental management? Does that play a role?
Yeah, absolutely.
Okay.
We want to try to minimize stress
Okay.
and create a calm environment for the cat.
So things like predictable routines,
Exactly.
quiet spaces,
Yeah,
and maybe even some pheromone therapy.
that can be helpful.
Okay.
And sometimes we'll also use behavior modification techniques, like
Alright.
teaching the cat to relax or to redirect their attention when they start to feel an episode coming on.
So it sounds like a multi-pronged approach is needed.
Yeah, it definitely takes a team effort.
Okay, well, this is all very interesting.
It is.
But we are running out of time.
We are.
So we're going to have to wrap things up here.
Okay.
But before we do, are there any final thoughts you'd like to share with our listeners about feline hyperesthesia syndrome?
Just that it can be a really frustrating condition
Yeah.
for both the cat and the owner.
Mm-hmm.
But there is hope
Okay.
with proper management.
Uh-huh.
Many cats can live relatively normal lives.
That's good to hear.
So don't give up on your cat.
Excellent advice. And on that note, we're going to end this deep dive.
Okay.
But we will be back next week with another fascinating topic in feline neurology.
Sounds good.
So until then, keep those minds inspired, hearts light, and tails wagging.
Absolutely.
Yep.
Yeah, it can be a really tough one to sort out.
Yeah. So it sounds like it's a diagnosis of exclusion.
It is.
You know, you've ruled out everything else, and you're left with...
And the cat's still doing this
Yeah.
weird stuff.
Okay.
Yeah.
So are there any other neurological conditions that cat owners should be aware of? Especially those that might present in kittens or younger cats.
Yeah, so one that comes to mind is cerebellar hypoplasia.
Okay. And what is that?
So this is a condition where the cerebellum, which is the part of the brain that controls coordination and balance, doesn't fully develop.
Okay.
So these kittens are born with a
Right.
cerebellum that's too small.
So they're going to be wobbly,
Yeah, they're going to be wobbly.
uncoordinated.
Yeah, they might have a head tremor.
And is this something that can be treated?
Unfortunately, there's no treatment for it.
Okay.
So the damage is already done.
Right. It happens during development.
Exactly.
So it's not something that you can go in and fix.
Right.
But can these cats still live happy lives?
They can.
Okay.
They can adapt amazingly well.
Really?
It's incredible to see.
So even though they might be a little bit wobbly,
Yeah.
they can still have a good quality of life.
They can.
Okay, that's good to hear.
Yeah.
Well, I think we've covered a lot of ground today.
Yeah.
From SE to FHS
Yeah.
to CH.
Cerebellar hypoplasia.
Cerebellar
Just a
hypoplasia.
mouthful.
It is.
Yeah.
I feel like I've learned a lot.
I hope so.
And I hope our listeners have too.
Me too.
Any final thoughts before we wrap things up?
Just that, cats are amazing creatures.
They are.
And even when they're facing neurological challenges, they can still have happy and fulfilling lives.
That's a great message to end on.
I think so.
So to all of our feline enthusiasts out there, keep those minds-inspired hearts light and tails wagging.
From Vet Neurojar.